Hi, my name is Dr. Sonia Simon, and I'm one of the podiatrists here at Dallas Podiatry Works. Today I wanted to discuss a really important topic of what to expect when you're going to have reconstructive foot and ankle surgery. A lot of patients will ask questions like, how many sutures will I get? What kind of plates and screws will I have? But there are really important things to consider before undergoing surgery. One of those questions is, what is the at-home recovery process going to look like? The first question is, how long should I expect to be off of my feet, not bearing any weight? Podiatric reconstructive surgery can require you to be off of your feet for a long period of time. However, most of our patients are on their foot in a surgical shoe the day of surgery. Your doctor will go over the exact range with you at your first preoperative visit, but you should be prepared for both scenarios when having surgery. The best case scenario is 2 to 4 weeks. The worst case scenario is 10 to 12 weeks. Next is mobility adjustments. Crutches and or wheelchairs are an option, but are not always practical for long periods of time. Knee scooters are also a good option and can be rented or purchased online. And some patients like the iWalk knee crutch, but your doctor will have to determine if this is a good option for you. Grab bars are also good to assist with stability in general, but also around your house, in the bathroom, and while bathing. Also very important is the subject of transportation. First, you will need transportation home from the hospital the day of your surgery from a family member, a friend, or acquaintance. It is not an option for your ride to be with a cab, Uber, Lyft, or public transportation. And actually, the surgery will not be performed unless you have an acceptable ride home. Once you're home from the hospital, you'll need a plan for those other methods of transportation, like with a family, friends, Uber, Lyft, and such. Keeping transportation in mind, if your surgery is on the right foot, you will not be able to drive until you're out of the cast or the boot. In addition, you never want to drive if you are taking narcotic pain medication or if you are in severe pain. Next thing to consider is bathing. You will not be able to get your foot or dressing wet until directed by your doctor at your first postoperative visit. Typically, this ranges from 1 to 3 weeks after surgery. Good options for bathing are a sponge bath or a cast cover, which we can provide. Additionally, shower chairs can be purchased online or in a surgical supply store and can be a good investment to help balance while you're bathing. Absolutely, please do not wrap your foot in a plastic bag. This can be dangerously slippery and lead to a fall. Also, it's best to be sure that you have a non-skid bath mat in the shower or bathtub. Then there are home adjustments that should be addressed. For example, stairs. If you have stairs you need to navigate, inform your doctor, and physical therapy can be arranged to help you if stair usage is needed. Ultimately, it's best to sleep and live downstairs if possible, and put the things you use most frequently downstairs too, like your toiletries, food, and clothing. This will help you stay off of your lower extremities. Moving furniture that's close together is best to allow room for your knee scooters, iWalk, and crutches. It can help to remove any area ruts you have as well. All of this will decrease your chance of falling while getting around your home during your healing process. It would be really helpful if you had assistance with basic chores around the house, like cleaning, cooking, and pet care. Speaking of pet care, you may consider having a family member look after your pet while you are healing, or if boarding is an option. Also, we do recommend that you prepare some meals prior to surgery and freeze them. Next, several days prior to surgery, we do recommend that you do a dry run around your home using your chosen mobility device and identify the areas where you will need access. Then you can make adjustments to problem areas as needed. For example, try accessing and using your bathroom, getting in and out of the shower, practice getting in and out of bed, and in places where you will typically plan to sit. All of this will simplify your life, especially while you're healing. Finally, here are some general tips. Staying hydrated is so important, so make sure you drink plenty of water. Eating a healthy diet will also assist in the healing process and will make you feel better just overall. This means limiting processed foods, sugars, and excess salt. We suggest eating good protein, fruits, and vegetables. Healing from surgery can be exhausting, so during this time we want you to rest as much as possible. All of these things can become issues if they're not thought of in advance. Feel free to discuss any of these things with your Dallas Podiatry Works doctor before undergoing surgery. If you have any further questions at all, please do not hesitate to call us. Thank you for being our patient, and we are honored to be a part of your healthcare team.